Yay Networks.
Hi guys, this is Kary.
And this is Kam.
And thank you for joining us. We're so excited to do this little podcast with all of you.
And we're so excited for you guys to get to know the real us. I know you only get to see a glimpse of us on the show, so we really want you guys to get to hang with us.
Yes, we want to talk about fashion, kids, health, anything that's going on in our lives.
And family and husbands.
Yeah, so tune in and, let's have some fun.
And girl talk.
Well, hi guys. Welcome back to Kam and Kary to Dallas.
Hey guys, I'm so excited to see everybody today. And I'm so beyond thankful and excited today because I have a dear friend here today with us, and I cannot wait to introduce you to her. Dr. Sam Raza is a clinical cardiologist with expertise in advanced cardiac imaging, which includes advanced echocardiography. Let's see if I say that right. Which is specialized ultrasound scan of the heart and cardiac CT. But Dr. Sam Raza is originally from London, England. She earned her medical degree from the esteemed Imperial College School of Medicine in London, where she graduated with distinction and honors in medicine and clinical sciences and surgery. She currently lives in Dallas, Texas, with her 2 children and a lovely husband. And her resume, of course, goes on and on and on. But I know we all want to dive in right now and get to know the real her and start asking her some amazing questions on how she got started and, what she's up to today. So let's do a warm welcome to Dr. Sam Raza.
Yes, so glad to have you here with us. And it's such a treat because, I was just talking to her before we joined, and I was asking her if heart disease and heart attacks have been a lot more prominent now after the pandemic and COVID and everything else, and she's saying that absolutely. So there's just a lot of things that we can all learn of preventative things, like your imaging. When, I want to know, when should we do that? Should I go? Is it time for me to do it? Kam, have you done it?
No, I've never done that.
That's a good question.
Should me and Kam go do it and compare it, Kam? Maybe we can compare how our hearts are. That would be fun.
If we're supposed to be, are we old enough?
Right. It's a great question. Thank you so much for having me. It's so wonderful to be with you ladies. I'm a huge supporter of women and, being a woman cardiologist and a mother and a wife and just, a supporter of women. It's just so great to have the opportunity to sit down with you all and talk about something that is so important just in general in life, but also just for our general health and our wellness. Thank you so much for the wonderful introduction. You're so kind, Cameron. Thank you so very much. And thanks, Kary, for having me as well. It's really a pleasure to be with you today.
Yes.
So great question. You asked a bit about what can we do to try and understand our risk for heart disease. And, one thing that I always think about is the absolute basics. So thinking first of all about risk factors for heart disease. And what I'm referring to really is the traditional risk factors such as high blood pressure or hypertension, talking about cholesterol, your hyperlipidemia. These are things that your doctor may pick up, or you may know about yourself, that you have a tendency to have a little bit of a higher blood pressure or cholesterol problems. And then the other big thing to focus on is family history as well. So I always tell people, choose your parents wisely, but I'm just kidding.
Because we can't.
Exactly. I always joke around with people about that. But it's really important if you do have an early family history of heart disease, parents or siblings have had early heart disease or carry risk factors for heart disease, such as high blood pressure, like I mentioned, or cholesterol, or have had a heart attack. It's important for you to think about what your risk might be, and it may be higher just related to that. And then we can do things, in the office, just really, really, really easy for us to sit down. And I always say, talk to the person. Let's talk about your history. Let's try and really go back to basics and understand. There's so many things I can detect on just having a conversation with somebody and looking at like a heart tracing called an ECG or an electrocardiogram. I can get clues about people's fitness level, or, if there's, any evidence of underlying high blood pressure, clues about that. And then, Kary, you mentioned a bit about imaging. We have such wonderful technology in cardiology that I use on a daily basis. And a lot of that centers around echocardiography, like Cameron was mentioning, which is a specialized ultrasound picture of the heart. It's just like a pregnancy scan, but we look at your heart function, size and structure, looking at and really getting clues about, is the heart working harder, or is there abnormal thickening or heart valve disease? Is there something inside your heart that could be causing problems?
And what is the procedure for someone to get an echocardiography?
Yeah.
They have to be put to sleep to do that?
No, it's just like a pregnancy scan. So we do it in the office. It's like a jelly on your chest. With pregnancy scans, we're doing an ultrasound of your belly. Yeah, there's no sedation. Wow. There's no, preparation time. It's really simple. We can get a real simple, great picture of your heart. Yeah, it's really neat.
That would be cool, Cam. We should try to do it and do it live on Instagram.
Oh my God, we should.
Yeah, so people can see how it's done.
Yes. Okay.
It's not painful or anything like that.
At all.
We're at the age where, what age specifically do you recommend people to start worrying about this?
You're not even 40.
I turned 40 January. I know I'm not 40 yet. January.
I'm 51. Maybe not like you're like 10 years plus younger than me.
Yeah. Yeah. Well, your energy's younger than me though, Kary. So your heart might be like looking like a 20-year-old in there.
And it's important, like you mentioned, staying physically active. That's probably one of the biggest things you can do, which is exercising and moving your body in any way that you enjoy. So, for example, exercising.
Moving your body any way, Cam, that you enjoy. You need to have more sex.
I would probably agree with you, Kary. My mouth is no comments.
So funny. Yeah, some people that's dancing, some people that's yoga. It's a combination of cardio. Some people like high interval training, others like to do things like hot yoga or Pilates, like we were talking about earlier. But really going out for a walk, a brisk walk, even things like housework, for example, if you're doing vigorous activity for about 30 minutes, 5 times a week is what we recommend for your heart.
Now, if I don't run, is that a bad thing? How some people like to run for their cardio. I don't like to run. I love to walk and I love to do like the elliptical. Is that like high impact enough?
So I recommend to keep your heart rate up a little bit. We're looking for 30 minutes of moderate intensity physical activity. So that really just means, say you were having a conversation with someone on the telephone, you'd be able to hear it a little bit in your breathing. Your heart rate's getting up. You don't necessarily have to be exercising at a super high intensity level. So if you'd love to walk, that's wonderful.
Yeah, Cam, like those walks that I make you do with me?
Yes.
That would be a good workout.
Yeah, I'm a great hiker. I like to hike and I like to walk, but the running thing, long periods of time, I can't do it. Like I'm like, okay, well that's
I can't either.
Okay, well that's definitely good to know. Okay, so I also want to know, Dr. Raza, how did you begin like knowing you want to be a doctor? Like, how did you decide? What age were you like, wow, I want to be a cardiologist?
Good question. So I'm kind of one of these people that was always fascinated by medicine and science. And actually, my parents are both physicians and they work in London. So, inspired a lot by them and the fact that they work so hard and have dedicated their life to the profession. So naturally, I saw that a lot in my own personal life. And then regarding cardiology, so I was like the kid in, primary school where I would be like, what do you want to be when you grow up? And I'd say I want to be a doctor. And actually it's so funny because I have a 7-year-old girl and a 5-year-old boy, and my daughter wrote down, what do you want to be when you grow up? And she spontaneously wrote, I would like to be a doctor. And I was
oh
like,
my gosh,
that's so great.
So that's kind of great because I always saw my parents enjoying what they did, and it's really great to give back to people and serve and be of service to other people, which is kind of what drives me. Specifically becoming a cardiologist, I was early in medical school, and you start off by learning about like the very basics. We're talking about the cell,
yeah.
And I was just, something clicked in my brain, and I'm like, this is really interesting, and cardiology just worked with my brain. I find it to be easy because it really just makes a lot of sense. And then it's also obviously the heart's such an important thing. It's such an important organ. It's like one of the most vital things that we have inside our body that keeps us alive. And so, just learning more about that, I just became more and more fascinated, and then started doing research, and really just, I've been really fortunate, but have had the wonderful opportunities through my training to have some great, mentorship and just learning so much. So I love doing that.
So if there is one thing that you can, tell people out there, like what is the one thing that could save your life if you feel like you're having a heart attack, or what is a symptom, or what
I
is
had that on my questions too, Kary.
huh?
Yeah.
I had that on my questions too.
Yeah.
It's a great question.
I know that.
So you may know, and this is like probably the most important message for the audience and everybody, and us women, us together talking about this, which is heart disease is the number one killer of women.
Oh my gosh.
Yeah.
I did not realize that.
Yeah, exactly. And so, especially being a woman cardiologist, I feel like it's so wonderful that you do this great awareness. This is great advocacy right here, raising awareness for that on this platform, but also, thinking about what the risks are for heart disease and what the symptoms are. So great question. So things like, there's a lot out there that say women present with different symptoms to men, for example. But what we find is that the main symptoms of heart attack are chest pain, chest discomfort or tightness across the chest, shortness of breath. Sometimes it can be associated with a cold sweat or jaw pain, sometimes arm pain. And in women, we tend to have more associated symptoms than which are accompanied by the traditional symptoms as well. So it's really important, if you're a woman who's experiencing any of those symptoms, it may be a sign of underlying heart disease and worth getting checked out. So like we mentioned, we talked a bit about imaging. It's quite easy for us to figure out what's going on, at least provide some reassurance or some further investigation into what's going on.
Interesting. Okay.
Interesting. And then should we call 911 immediately? And then is it best to have an ambulance come get us? Or do you think most of the time people can make it to the hospital?
Right. If you're worried about you're having sudden symptoms of heart attack, like we mentioned, chest pain, shortness of breath, you've broken out into a cold sweat, or if there's something that really is seriously wrong, call 911 and don't hesitate and seek emergency medical attention. A lot of this also we can, that's kind of regarding that, but we can also figure out by making sure your blood pressure is well controlled, making sure your weight is under control, following a healthy lifestyle. We talked about exercise and, diet is like, we can talk about that in some detail as well. But those are the things you can do to prevent heart disease. And then obviously knowing your numbers, we can do some imaging tests and things that can help us understand more.
Okay. And I have another question. Like, so for me, I feel like I'm very healthy. I work out, I eat very good. And the past couple of times my cholesterol has been high. Like, isn't that weird?
What's up with that? Yeah.
Yeah.
So, I mean, some of it is, a lot of it depends on so many different things. And some of it does come down to both lifestyle and genetic risk factors as well. So sometimes people develop high cholesterol because they have a family tendency to develop it. And so, even with a perfect lifestyle, we can still have a bit of a high number. Now, one thing we can look at is really digging into your diet, thinking about what are we eating? We talk about saturated fats, dairy products.
If you have a hot dog before you get a test, that's okay. So my daughter had a hot dog before we went and got a blood test, and they told her not to eat, and it spiked it really bad. That's like possible, right?
We generally recommend to stay to fast before a blood test for cholesterol.
Okay, and then we went back and it was normal. So I was like, thank gosh. But we were like, oh, that hot dog.
There you go. Yeah, I mean, you never know how things affect people, but avoiding saturated fats, processed and junk foods, fried foods are really notorious. And then, there's other things that we can do other than just a number. Blood work is important, but it really is about I'm looking at someone's whole cardiac risk, like are there other features that could be concerning? And then we do have options for medications, of course, if that's something that becomes relevant. But things definitely to focus on are lifestyle, diet control, and, sometimes there are some genetic components as well.
Wow.
Okay. That's very interesting. Kam, do you have another question?
So your cholesterol starts getting really, really high. Obviously the doctors will put you on medicine that will kind of reduce that, correct? Do you usually have to stay on that medicine the majority of your life once we get on that?
It's a good question. It's a really individual case by case,
Okay.
so it depends on the person. A lot of people they don't really want to take long-term medications, and that's completely understandable. And I also will say that there is a lot of things that we can do with regards to lifestyle.
Okay.
Sometimes, we talked a bit about imaging beforehand, but, there's other tests such as a calcium score test, which is a screening test for heart disease, which can also be helpful. So just reviewing of all of those things can be helpful.
Okay.
Okay, what technically is cholesterol? Is it just like, is it a chemical? Like, I really actually don't know what that is. I just know about the test and everything.
Yeah. So, in your blood, there's different components. So you've got like white blood cells, red blood cells, you've got the plasma, which is the kind of straw-like fluid that it consists in your blood. And then there's different components, so cholesterol is a type of let's say type of substance that exists inside your blood, and it essentially is made up of fat, and it's a type of it's a compound that we can check for, and we actually check blood levels of the cholesterol as well, so we can check how much, what's the number, how high it is, compare that to the normal range. So it's basically made up of fatty, products, and there's different types of cholesterol. So you've got good cholesterol and bad cholesterol, and the good cholesterol we refer to as an HDL, or high density lipoprotein, and then LDL, which is your bad cholesterol, which is your low density lipoprotein. So we actually review these in terms of size, so it just depends. And then we get into like more complex analysis, which we can sometimes talk about. But what's important is also, what the level of cholesterol is, but also if there's evidence of plaque buildup inside your heart and blood vessels. Because if there is plaque buildup, then sometimes it indicates that your cholesterol level has been running a little higher, or you've got a tendency to build blockages.
And you can see that through those imaging?
That's correct. Yeah.
Mm-hmm.
Wow.
So guys, it's so important to get this imaging done. Definitely. This is for your health, and this is so important to do.
Right. Okay, so how do you juggle mom life with your husband and your children and with all your, patients? How do you do it all? Because you are a total boss babe. I don't know how you do it all. And you're such a good friend too. So it's like, how do you do it all? I just don't know.
I try my best. Some days, I'm not perfect, definitely. I just try my best, like every other mom out there, and a woman who's working. It's a constant balance, as I'm sure you both know very well, and some days you do better at something and you may not do as well as at something else. And so the biggest thing I do is, I try and compartmentalize as much as I can. I'm also so dedicated to, my patients, but also to family, and, obviously try and make time for things. I think it's just a game of balance, and it's just this big puzzle that we try and move the pieces around and just try our very best.
Okay. I love that.
Yeah.
Well, I have another question. So is your heart like, when you go on to have, like, say, surgeries, whether it's, I had a very major back surgery, and I've had other, C-sections and plastic surgery and all of that. Is your heart affected the more you go under the knife? Is that going to be an issue later on in life?
It's a great question. I think one thing we look at is, and something I focus a lot on, is preoperative assessment. So someone who's thinking about going for surgery of any type, and we're thinking about what the risk is of heart disease. What is the risk of this particular surgery and for this person, and what we know is that there are things that we can do to try and understand more. So for example, blood pressure, like we talked about risk factors, like real basics, trying to understand, is someone's blood pressure well controlled, or, do they have heart disease that's known before going into surgery? And the other thing I'll say is that it really is the exposure to anesthesia, so going under, sometimes it's the surgery that can be posing a risk to someone, because any surgery is a stress on the body.
Some people die having a heart attack in surgery,
happen,
and that's why I'm trying to figure.
Right. And so knowing, going to see a cardiologist or getting some risk assessment done is helpful before you have surgery, because that gives us an idea of, like, is this a high risk situation, or is this something that we think you can safely have? It depends on the individual. But, certainly if you need surgery, or if you're planning elective surgery, it's pretty standard. And I would recommend that you get seen by a physician who can identify your risk factors. And certainly as a cardiologist, it's something I get asked to do a lot. So I provide like risk assessments for, reviewing someone's individual risk for going for going under the knife for whatever reason they choose.
Yeah, Kam, because, I have heard before, and, in the past, and people, that people end up like dying
Yeah.
getting a boob job.
Yeah.
I mean, so it's kind of like the boob job is not worth dying, right?
We learned that most people die too from the butt implants. Remember the butt implants?
Oh yeah, the butt implants.
We learned that on our podcast.
Yeah, a lot of people because they're getting like infection, but that was not like such a hard thing. But I mean,
a hard thing. You're right. That was blood clots, right?
That was blood clots. Yeah,
I'm learning too.
Yeah, but I mean, we had a plastic surgeon on our podcast, and we learned a lot about plastic surgery and things like that. But which I mean, is great. We all want to, I definitely want to get my next surgery is going to be a little, lift.
Tough.
But I rather not look amazing and be alive, right? So it's so important to go, and everyone out there that if you want to do elective surgery, check your heart first. I mean, so it's worth the time and investing on that because I mean, after some stories that I've heard, like I'm not going to do any surgeries without going to see Dr. Raza first.
Yes. Okay, we were wondering what is the most extreme and scary story that you have sharing, like as a doctor, seen or been around?
It's a good question. I think there's just so much. Of course, like for general, we keep a lot of things confidential just because of privacy, as those are laws and rules. It's really to that type of question. I think, a lot of these things, I was thinking, it's funny you asked me because I was just reflecting about my training and, my pathway and how it's been. Because now, obviously I'm practicing as a cardiologist and I love it every single day. But sometimes you get flashbacks to certain things, you're maybe treating someone right in front of you, but you realize that the reason that is because you had to witness something or you were part of something when you were in your past training, and it gave you the knowledge to be able to understand that. So then you can help somebody else, some of those situations come down to, just serious situations. For example, in the operating room, there's many things. It's scary when you see your first patient that's having a heart attack and that they're having a heart attack and, it's an emergency. So, those are the experiences that I've gone through my training and really help you understand. But I think it's really also really important to understand that it's a person right in front of you. It's definitely, it's a medical condition, but there's a human being and it's someone's mom, someone's sister, someone's wife, or, it's a family member. So that's kind of how I treat my patients. So I think that's really the most important thing. That's kind of been my experience.
I mean, have you had to go tell families that the person passed away?
Yeah, we have difficult conversations sometimes. Yeah, with that. Yeah. Mm-hmm.
I can imagine. Oh my gosh. Okay. So, basically there's different heart valves in your heart. Now, can you explain what the Widowmaker heart valve is? Because, you always hear that Widowmaker.
Yeah. Right. So just to kind of briefly, just for everybody's, because I like to keep things simple because I'm a real visual person. So usually I'm popping up a picture in my office and I've got this like picture that's like a cartoon. And I think about the heart as like it's got 4 rooms and it's got 4 connecting doors. And so there's 2 sides of your heart. There's a right side and a left side. And there's these valves, which I think of as like doors, which open and close with every heartbeat. And the whole function of your heart is to pump blood, right? So you're trying to pump blood out from the right side to your lungs. And then that blood gets oxygen and then it comes back to the left side of your heart and then it pumps blood to the rest of your body. And so, the function of your heart is to make sure the blood goes from one room to the next room and then to the lungs and then comes back. And it doesn't come in the wrong direction. So that's why these valves, which are like these connecting doors, live inside your heart. And so what you're referring to is the Widowmaker, which relates to the coronary artery. So the heart itself is also supplied by blood, and there's 3 blood vessels around your heart. 2 on the left side. One is called the LAD, or the Widowmaker, left anterior descending coronary artery. And then the other one is on the left side called the left circumflex artery. And then there's one on the right side, which we call the right coronary artery. And so what we talk about, the reason the Widowmaker is so important is it supplies about 2/3 of the heart muscle. So if that blood vessel gets blocked, or if you have a heart attack, it's quite common to understand that some people have a heart attack which involves a Widowmaker. That's a large amount of the heart that's at risk, right? And if you can imagine, we think of in cardiology, we refer to time as muscle. So if the blood vessel gets blocked suddenly, then that leads to death of the muscle within seconds. So it's really important. Every minute counts, And so it's important that if someone's having a heart attack, that's why we're rushing. When someone's having a heart attack, we want to get treatment immediately. You want to call 911. You want to get emergency medical attention and get that issue taken care of so that the blood vessel gets opened again. Because what we recognize is the longer it takes to get that blood vessel open, there can be more heart damage. And so that relates to the
I'm starting to get anxiety right now.
I'm like sweating. I'm like, oh.
Me too. I'm like, oh my God.
It's okay.
I
I'm afraid of blood.
Or like I can't even get my blood taken.
Yeah. Oh, I know. Me too. We both faint.
Yes, we both faint. And then I'm like a hypochondriac. I'm already feeling like I'm having a heart attack over here.
I know. Okay.
I feel like I'm short of breath. I'm like, oh my gosh.
Do you ever feel like you ever gonna faint when you see too much blood, or
I never had that. I was never that person.
Oh. I could never be a doctor.
I heard it's like genetic, right? Isn't there like a term for this when we're like afraid of needles and blood?
I think, so you described like fainting, with taking blood. So we do recognize some people have something called vasovagal syncope, which is where they pass out when they have like seeing something, when they get blood draw, or if they're, in a situation like that. So yeah.
Say that
they have to lay me down, and I'm a big baby, and I had 4 C-sections.
Yeah. What is the word called again?
Which one?
The
term that we have that when we faint.
Because sometimes we call it vasovagal syncope. Yeah,
okay.
Vasovagal syncope.
Yeah, a type of condition where sometimes people faint.
Cameron, you and me have that.
I wrote it down for us. I definitely have that. Okay, the other question I have for you, which is off the record with Dr. Steph, but what is your favorite TV show? I know it doesn't have to be Housewives, of course. It could be anything, but what is your favorite TV show when you're done with work and you just want to relax?
A great question. So I was watching, so I actually really love like period pieces. So I love to watch, anything related to, the Tudors, or just with, old history, that type of thing. So I really enjoy that. I do love reality TV as well. So I love to watch those types of things.
So you don't like watching like Grey's Anatomy and all those?
I have watched those. I think they're fun. I was watching the Bridgerton shows. I think that's so cute and fun. So I really enjoyed that a lot.
Okay, since you do watch Housewives, what is your favorite franchise? Obviously, Dallas is off the limits right now, but what is your favorite franchise?
I actually really love, I love to watch the New York City Housewives. They were really interesting because I just think they just lead such interesting lives, and it's so fun to watch. They're so different. I love reality TV. It's just so fun to watch.
Yeah. It's fun to watch, but not to be in the middle of all the drama.
I know. And I just heard Sonia and Luann have a new reality TV show that came out. They announced yesterday. So I can't wait to start watching that. I don't know what it's going to be like, but it's kind of going to be like similar to The Simple Life, I think. So I can't wait. That's going to be really fun.
Exciting to watch. Yeah.
Yeah. I'm currently watching the TV show right now, Inventing Anna. Have you guys watched it yet?
Oh, I love it.
It's a great show.
Oh my God, it's so good. I can't stop. I'm on episode 3. I'm like, I don't want to leave my house right now, and it's beautiful in California, and I'm like wanting to watch it.
I know. I like literally binge watched that show in like 2 days.
That
was insane.
See.
Yeah, it was really good.
Oh my gosh. Okay, so also, what is probably what is another exciting story you can tell us that has happened, like a miracle story? Has there anything been out of this world that you can never imagine actually happened?
I think, this is a great highlight. Knowing, just coming on and talking about something I do all the time, and raising awareness for heart disease. So, this is kind of amazing. It just is so great to be in Dallas and, be with both of you, just to have this opportunity to talk to so many people and spend time with you. So it's wonderful to do that. It's great. I feel like things that I do every single day, it sounds really ordinary, but it makes a big difference to people. And I just feel so lucky that I get to meet new people every single day and really have an impact on their lives and their heart health, so that really is very gratifying. So I love to give and be of service,
So do you believe that it's so important to be donors of like heart, like how many people are really out there waiting. What is all of that? Because, I think
Good question.
like heart donor, because I do have that on my driver's license, but
Yeah, I mean, we have a separate specialty within cardiology that deals with heart transplantation, or people who get we call it the advanced heart failure or transplantation specialty of cardiology. And so it's a really complex process that involves cardiologists, heart failure specialists, because of course if you're looking to get a heart transplant, you're in a serious condition where you have like end stage heart failure, your heart's not working properly, and so you've gone through treatments and it's just not. It's almost like a last treatment resort that we look for. Definitely everyone has their personal views about it. What I can tell you from a general standpoint is there is always a shortage of organ donors. So if you're in a position that you feel that you want to give and be in a position to donate like an organ to somebody else, it definitely could have such a huge impact on the recipient and their patient's entire life, and also their family, of course. So but definitely it's an individual decision for you, and so but we do have like other cardiologists that deal with that, and it's a whole specialty because it involves like many different people's opinions, and there's
I definitely, like, I want to be cremated. So I'm like, oh yeah, take everything that you can use out of my body and then, cremate me. I mean,
thanks for sharing that though. It's wonderful to know.
Aw.
What about you, Kam? Are you a donor?
Well, so this is crazy, but I heard a rumor, like you're probably going to correct me on this, but it's
I know exactly. I heard it too.
Not true. It's probably 100% not true. But this is horrible. But I always was worried if I put the sticker on that they're going to be more likely to let me die, because they're like, oh, well, we want the organs for other people. Obviously, that's probably 100% not true, right?
Yeah, I mean, definitely, I can speak from my own practice. I'll say that the goal is always to save the person, if it's possible. So I don't know that has a big impact on, when someone's coming in for emergency treatment, or if they've had some serious incident or surgery that they need. The goal is to help the person that's right there in front of you. And sometimes it's not. We don't always know, depending on the original treatment. Yeah, like till later. But I'm not sure that's something that the way that I practice. Yeah.
If they don't look at the card later, then that totally explains that whole thing, right?
But yeah, I mean, usually it's just about treating the person that's right in front of you and taking care of the urgent medical issue that is going on at the moment.
Mm-hmm. Right. See, that might change my whole decision. I might put my sticker on now. So I might put that donor sticker on now.
Yeah, but I have heard that too, Kam.
Right. And so that was always a worry of mine. I was like, and so I was like, but then now that I have, now that they check it later, because that makes sense. If you're in an emergency, they probably don't even look at that until later. So that probably makes sense.
Yeah, I think the doctors would most likely would be looking at how they can treat you in that moment, to try and help save your life if you're in an urgent situation, and so that would be the biggest priority.
Oh, gosh.
We don't want to think about it, right?
Oh my gosh, I know. Like honestly, I think of sometimes the worst stuff ever. I'm like driving on a freeway. If I'm driving too fast, I like slow down because I'm always like, oh my God, I can't get in an accident.
I've totaled like 4 cars.
Oh my God.
In a few car accidents.
Oh, I hold on when I'm in your car.
In an ambulance.
Right, I definitely hold on. But I did dodge an accident when I was in the car with you, Kary. Remember that one day?
Oh my, we would have been like, maybe in the hospital right now.
We might have. Yeah, I literally swerved so fast. This car stopped completely in front of us, getting on the on-ramp. It was so scary.
Oh my goodness.
Oh my gosh.
Yeah, I was very impressed by your movement, Kam.
And that was like natural. And I was like,
I know.
It naturally happened because I had to think so fast. And I don't know how it happened. And I was just lucky no one was in the left-hand lane. If someone was in that left-hand lane, we would have like ran right into that guy.
Yeah.
I'm glad you guys are okay. Gosh.
Speaking of, do you deal with a lot of emergency accidents like that with heart that they call you in the middle of the night? Are you on call?
Yeah, I'm on call. I take call every, I work full time, so taking call as well. And a lot of that, some of that with regards to trauma, sometimes it's the trauma doctors that get called first. And of course, if there's a heart issue, then we get involved and deal with that. So yes.
Mm-hmm.
Yeah, you always want to have the specialist.
Okay, so how do you guys wake up in the middle of the night? Do you have like a special number that goes through to alert your phone?
Yes, yeah. So I still carry a pager, and I'm like really old school. But I worry that I just find it just works really well. And then of course, like we have our numbers, and sometimes they have our direct lines, which is helpful. So it's just I'm just so used to carrying a pager, so I have my little pager.
Cam, it's like having a newborn all the time.
Yes.
Like when they cry, you just have to get up, and that's like a doctor having a newborn.
Have you and your husband ever been both called the same time in the middle of the night?
Yeah, we have before. So we used to, yes, we have. The answer is yes. I mean, it's just, like I said, a juggling act, So easier when we didn't have kids, but now obviously when we have children, so we always have this, like a part of that big puzzle I was talking about with balancing is like childcare, as we know, all of us are dealing with all the time. So just to have, we try our very best. And so sometimes there was, there's definitely times where you have to juggle, make sure the kids are taken care of so you can go take care of other things. So we try and we set ourselves up for success, so we don't have to get into those situations.
Okay, question. Heart planner, or do you have everything loaded in your phone?
So we just started using this online. Everything's on the phone, but we have a shared calendar that's shared across everybody's devices, so we can all see what everyone's up to. So everything goes on the schedule. It keeps us organized.
I like that.
Well, guys, I just want to say that I am going to go and get my heart checked. I want to get one of those imaging things. I am going to do a little, guys out there. I will put it on my Instagram stories. I want to see all of you watch it, do it. I recommend all of you go do it. Dr. Raza, tell everybody, where can they make an appointment? Give them your information. Where can they find you? So I'm also on social media. So you can follow me on Instagram at Dr. Sam Raza, DrSamRaza. And then I work at, I have my office in Dallas. And so I'm at the 4708 Alliance Boulevard in Pavilion 1, Suite 500. And that's in Plano 75093 in Texas. And you can just give us a call on the office number 972-941-3100. Or, you can follow me on social media for information about heart health. Yeah. If you want to make an appointment, call that number. Give them your number again. It's going to be 972-941-3100. Yes, everybody make your appointments, go see the doctor, get your imaging done. Tell me about your experience. Share it with me on Instagram and Cam. We would love to hear about, if this has been helpful, if there's any other questions you have, because we would love to have her again. If you guys, have a lot of questions that you still want to know and everything else. So please, please, please get your hearts checked. It's so important. It's like you said, the heart is what makes us be alive. Yeah. So of that little thing in there that makes us. I couldn't have said it better myself. It's so important. And thank you for raising awareness. And thank you so much for having me.
Yay.
Thank you, guys.
Okay.
Bye, Cam.
Bye, girls. Miss you so
everyone.
much.